What's up guys, ZMD here. In this video, let's talk about something disgusting. I am in the mood to gross all of you guys out, so I mean, come on. I haven't really done it so far, so why not? I don't think after practicing and being and just living in medicine that it's really possible to get grossed out by anything. I challenge you, try me. I'm a shield to that. What's that shield with the star on it? The Captain America, I think. Something. Actually, I remember when I first did my GI rotation as a med student, and I think they scoped someone with pseudomembranous colitis, and that C. diff smell, yeah, that was a smell to forget. So I definitely gotta up my smell game for that. Anyway, some of you may have heard of fecal transplant.
Nope.
So what exactly is that? When do you do it, and why do you do it? All that and more coming up in this video. Guys, if you haven't already, come on, what you waiting for? Let's smash that subscribe and like button before proceeding. Okay, so recurrent clostridioides, formerly known as Clostridium difficile infection or C. diff, is a bad infection that can happen often when your gut flora is altered, and usually it's in association with prolonged antibiotics. And a recurrent infection is defined by complete abatement or resolution of your C. diff symptoms, which are like your watery diarrhea, your fever, nausea, abdominal pain, while you're on the appropriate antibiotic therapy, followed by a reappearance of the same symptoms within 2 to 8 weeks after treatment has been stopped. Now, recurrent C. diff occurs in up to a fourth of patients that are treated with antimicrobial therapy for it the first time. And so some of the risk factors for developing this condition are recurrent and prolonged antibiotic use or proton pump inhibitors. That's like your stuff like pantoprazole, omeprazole, that kind of stuff. Hospitalizations and other risk factors, including just older age and things like that. Now, let's reason this out together. Fecal microbiota transplant is the use of processed stool that's collected from healthy donors into the intestinal tract of a patient who has recurrent C. diff, and this is effective for the treatment of recurrent C. diff. Fecal transplants are, in general, a relatively new therapy, and protocols vary between different institutions, and the comparative efficacy studies are a little bit few and underpowered at this time. But let's talk a bit about the rationale. So your gastrointestinal tract harbors a highly complex community of hundreds of different types of microorganisms, and these bacteria do a lot of good things for you, including aiding in your host vitamin synthesis, your fermentation of carbohydrates, metabolism of bile and host hormones, and of course, fighting off competitive bad guy pathogens that are attempting to take residence in the gut community. Now, the microbiota also influences the development and maturation of the immune system, so they're important. They're important. Administration of antibiotics can significantly alter this composition of the normal microbiota, which can lead to removal of the so-called good gut bacteria, and it can ultimately predispose the host to infections such as our lovely C. diff. So now let's talk about candidates for fecal transplant. So fecal transplant is recommended for patients that have like a third or subsequent C. diff recurrence despite being treated with appropriate antibiotic therapy for the C. diff infection in the past. So I know this sounds confusing because I just told you that antibiotics can cause C. diff, and now I'm saying treat it with more antibiotics. I know, hang with me. I promise, it'll get easier as we go. So let's say you get a pneumonia or some type of skin infection, and you get like ampicillin, or they give you clindamycin in the ER or whatever, and you happen to have a lot of these risk factors, and let's just say lady luck isn't on your side. Well, you can get C. diff, which then is treated with antibiotics like oral vancomycin is a commonly used one. And if despite you getting the antibiotics, you keep having these recurrent C. diff symptoms, well, you may just be a candidate for fecal transplant. Lucky you.
High five!
Now, the recurrence of C. diff is an increasing problem following antibiotic therapy. Patients that have recurrent C. diff have been observed to have reduced diversity of the intestinal microbiome and diminished numbers of bacteria relative to healthy individuals. So gross, but it's intuitive that if you transplant some of the stool microbiota from healthy individuals to patients with recurrent C. diff, then you can restore some of the missing strains and break that cycle of recurrent C. diff infection. Genius. Now, a word on safety and efficacy. So the good news is that the efficacy of fecal transplant has been evaluated in several randomized controlled and open label trials, and a lot of the literature says the cure rates are anywhere from 70 to 90%. That's pretty good. Sometimes more than one administration of fecal transplant may be necessary for optimal efficacy. However, the FDA generally recommends only a single administration. In addition, C. diff has been associated with bloodstream infections, and fecal transplant just so happens to decrease the strength of that association. Fecal transplant appears to be safe, and most of the common symptoms are just going to be like abdominal discomfort, and they usually just get better on their own. Although there is an emerging evidence suggesting the utility of fecal transplants for initial therapy of C. diff, this requires further studies before it can probably be routinely recommended. I know. And I have a feeling our patients would probably not like this as a first-line treatment. I mean, I certainly wouldn't. Now, let's talk about some of the delivery routes. So there's plenty of ways that we can do this. Some of the more common and easier ways are just through oral capsules. They give fecal transplantation via oral capsules because it's typically very convenient. It's non-invasive, and the efficacy is quite good. You can have it done via colonoscopy, which allows the delivery of the donor stool, boom, just shooting it right in. And you can have it done with retention enema. In a trial that included 116 patients with recurrent C. diff, randomized to fecal transplant that was administered via oral capsules or colonoscopy, the cure rates for prevention of recurrent C. diff were 96% in both groups at 12 weeks. Hallelujah. Hooray! So it doesn't seem like there's a whole lot of difference. Obviously, talk to your doctor about what method is best for you in your particular circumstances. Okay, so I hope y'all learned something in this video right here. Now do come back to my channel, you hear? Take care, guys. Keep being a boss.